And Dr. Fauci, why don't I start with you? Are children almost immune to the disease? Just yes or no, because I've got a lot to get through, please. Are children almost immune to the disease?
We have to
okay.
Be a little bit more precise. You mean almost immune. Do children get infected? Yes, they do.
Have hundreds of thousands of children been infected?
Yes.
Hundreds of thousands of children been infected, so children are not almost immune to the disease. Is COVID-19 going to magically disappear, Dr. Fauci?
I do not believe it would disappear because it's such a highly transmissible virus. It is unlikely that it's going to disappear.
Does wearing a mask give people COVID-19?
Does wearing a mask give it? No.
Okay.
Not to my knowledge.
All right. Is COVID-19 a hoax?
No.
Should people take hydroxychloroquine as a cure for COVID-19?
The overwhelming cumulative evidence of properly conducted randomized controlled trials indicate no therapeutic efficacy for hydroxychloroquine.
Can people cure themselves of COVID-19 by injecting themselves with disinfectant
No.
or bleach? I'm sorry?
No.
Are you safe from the disease if you go to one of the aforementioned large assemblies, crowds, demonstrations, without a mask on and not observing social distancing, if you sign a waiver that you won't sue the sponsor of the event?
I'm not so sure those things are connected, but I'll repeat what I've said multiple times, that being in a crowd, particularly without a mask, is a risk for acquisition and transmission.
Okay, but signing a waiver doesn't confer any kind of immunity on you from being infected by the disease?
No, of course not.
All right. Dr. Fauci, the European governments are in a completely different place. They've got the disease on the run. In fact, the Asian countries have the disease on the run. I saw some remarkable figures. Almost every other country on earth is doing far, far better than the United States, except for Brazil, whose president has followed President Trump's policies. But we have 153,000 dead. Canada, our next door neighbor, has less than 9,000. We have 17 times the number of deaths from it. China, which of course is much larger than the United States, has lost 4,661 people. We've lost 153,000 people. Our rate of death is 36 times higher than China, and on and on. Do we have the financial resources and the scientific expertise in America to do what other governments have done to bring the infection rate down to something manageable so the end is in sight of this nightmare?
I believe we do have the tools, and certainly there's been a considerable degree of financial investment.
So what is the difference? Why are all of the other countries defeating the disease and we're not? Why do we not have a plan, a strategy for victory to win, to beat COVID-19?
Well, I believe I addressed that in not only my opening statement, but also in response to the question of the congressman. And that is that when you look at the comparison between Asia and Europe, as is shown by the chairman's poster up there, that when they shut down to the tune of about 95%, getting their baseline down to tens or hundreds of cases per day. So whereas when we did it, we got it down, but unfortunately, our baseline was 20,000 a day.
All right, so we're getting somewhere, but would you agree with me that the critical difference is either the presence or the absence of social cohesion and political leadership to actually develop a plan, execute it, and stick to it?
I think there was such a diversity of response in this country from different states that we really did not have a unified bringing everything down.
Yes.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.